Hello, and welcome to today's episode of the Making Healthcare Better podcast. My name is Rakia Campbell, and I'm your host today. Now, as the number of older adults with chronic medical illnesses and substance use disorders, such as opioid use, increase, so does the need for post-acute care services in skilled nursing facilities. In our last Making Healthcare Better podcast episode, we chatted with Dr. Swati Gaur. Dr. Gaur is Alliant Health Solution's medical director, and she is also a practicing physician who specializes in geriatric medicine. She is back today with us, along with Wilbert Martin, the Center of Excellence for Behavioral Health and Nursing Facilities Recovery Specialist. Together, they're going to share insight about what nursing facility staff can do now to help provide better care for residents with substance use disorders. So, the last time we chatted, Dr. Gaur enlightened us on some of the challenges nursing homes currently face in providing care for residents with substance use disorders. So, Dr. Gaur, can you provide a brief recap about what staff are experiencing that may be barriers to providing optimal care?
Sure. When we talk about staff preparedness, that is the number one thing that we talk about when we see these barriers. The other one is, of course, staff perceptions of addiction. And the third one is overall lack of resources that could definitely present as barriers to providing the right care to our residents who may be suffering from substance use disorders or serious mental illnesses for that matter. So when we talk about staff preparedness, we are talking about in nursing homes, traditionally, we have had a very, reactive environment. When I say that, what I mean is we can certainly treat a urinary tract infection, we can certainly treat a pneumonia, but, it's making sure that we are kind of taking good care of chronic medical illnesses, something like, hypertension, diabetes, and having good systems that ensure good control and optimal treatment of these. Similarly, substance use disorder is also a chronic medical illness. And so, in this reactive environment, it becomes that much harder for staff, who really kind of do not perceive that the substance use disorder is actually a chronic medical illness, is so much harder for us to be able to optimally treat that. The other issue that we are seeing also that we see with other chronic medical illnesses as well is the fact that we have such siloed environment, right? A lot of times the treatment for substance use disorder may be happening outside of the nursing home setting, in pain clinics or other opioid clinics, that treatment just doesn't patch up very well or kind of flow nicely into the treatment plan within the nursing home as well. And lastly, but very, very important, is, with the lack of awareness, there's a general lack of training. And, just knowing what this is about and really being comfortable that we have the knowledge base to manage these illnesses within nursing home care.
Very good. Great information. Now, Bert, you being a recovery specialist with the Center of Excellence for Behavioral Health and Nursing Facilities, you work really closely with these facilities on providing those trainings that Dr. Gaur mentioned. What are some of the things that you're seeing regarding substance use disorders in nursing facilities?
Well, Dr. Gaur, she referenced preparedness of staff, and it really took me back to my early work in behavioral health. As a direct care staff, I was often transferred to a unit that treated substance use disorders, and I was not a big fan of that transfer. I was not a big fan of working on that unit. And I think my feelings came from just preconceived notions that I had, just a lack of understanding about chronic illnesses, about substance use disorders. So this conversation is just like really taking me back.
Mm-hmm.
So if we fast forward to today,
Mm-hmm.
um, I'm getting a lot of those same feelings from the direct care staff, from the staff that actually work with residents, directly hands-on. So yeah, I get a lot of requests for training, for more information, for resources related to substance use and substance use disorders.
Interesting. Interesting. Thanks for providing that insight. Um, Now, Dr. Gar, I know, as Bert just mentioned about training and preconceived notions, is there something in particular that you've seen in this area as well that has really is helping provide a shift in people's perceptions?
Yeah, I mean, I really appreciate Bert, you sharing your story because
Mhm.
all of our stories are similar, right? There has been a sea change in the way that we see these illnesses. We have come to this understanding of the fact that it's really a chronic medical illness. And I remember during my residency time, which now it's gonna date me, but I do remember that we used to call it, substance abuse.
Yes.
When we were treating patients during my residency days, and in fact, you might hear off and on, some of the older consultants or people who have practiced medicine during that era, that slips out, substance
Mhm.
abuse, but it is really called substance use disorder because people are understanding that it is really a chronic medical disorder that needs management. It is so I think we need to continue to, by doing even changing the terminology,
Mhm.
that goes a long way in kind of taking the onus and away from problematic patient, or it is the person's fault, who is actually suffering from this disorder, and provides with that empathy that is so required to be able to treat, or manage this chronic medical problem with, appropriately. So I
Mhm.
think, as we keep getting trained and we keep understanding the really the pathophysiology of the illness and different aspects of the illness, I think we start to peel the stigma off. By the change in terminology goes
Mhm.
such a long way that we need to be able to kind of get to a point where we stop blaming the person who is suffering and
Mhm.
instead creating a care team that is really able to support
Mhm.
management of the disease that they are suffering from.
Absolutely. So, in addition to terminology, what are some other perceptions that you're seeing in the industry that's hindering really providing optimal care?
Yeah, I mean, some of the perceptions that we just talked about, right? Blaming the person. Oh, it is, um, they decided to take the medication or etc., right? And the other perception that we see, and Bert, you can chime in, but we are seeing this perception of, oh, this person is going to be admitted to a facility and they're definitely going to manipulate that. They are opioid seeking, they are medication seeking, and that can really come into play when we see, especially medications that people, when they are coming in um, after like acute injuries, for example, right? You may have a patient with substance use disorder who may come in. Now they have broken a hip and they do need those higher doses or a differently timed doses of those, opioid medications because they were needing this much for treatment of their substance use disorder. They have just had, the acute pain, and they are going to need a different regime or a higher regime. And that's not drug seeking. That is not medication seeking. That is a true need that the patient has acutely. And how do we manage that, right? So those kind of perceptions, bad behavior, that whole moral stigma continues to be an issue. It prevents us from being able to step out from behind these perceptions and be able to provide the empathy and also the knowledge and management of these these illnesses and helping the patients.
So what are some possible solutions that nursing homes can actually implement right now?
The number one thing is staff training. The more I know, the better I do, right? And I think that is the number one thing. I think, we have this fear or phobia of being, that comes as a barrier in treatment of some of these illnesses. And I think it is because we don't know how to do it, right? I know that a lot of physicians and NPs and other clinicians, PAs, they are going to take, or they might already be taking those 8-hour courses, for, how to treat substance use disorder, that are now required for a DEA licensure. I think if you start, when I was doing that, even as I was doing that, I could understand so much more. I could brush up on so much that, allows me to be just so much better of a physician. Similarly, staff, in the nursing home, the more exposure we have to training, the less hard it becomes for us to manage some of these conditions. So that is definitely number one. Number two, as we see in other illnesses, right? Creating interdisciplinary teams, having standard protocols, and creating a priority, in the nursing home that we are going to be as a priority being, this nursing home staff or environment, creating this environment who will be able to provide care for these residents, right, with substance use disorders. And how that happens is really at the leadership level, right? Anytime we want to do anything, anytime we want to affect anything, leadership involvement and their investment of their, social capital, their leadership, exercising their leadership matters a lot, right? And that goes with whether you want to have your residents be protected against respiratory illnesses by having high rates of immunization, whether you want your staff to be healthier with, giving, asking them to get, immunized against flu and other respiratory illnesses, whether you want great antimicrobial stewardship to keep your patients safe. Similarly, creating that leadership investment into and messaging into this is a priority for our building or it's a priority for our organization is important. And then the other is also a lot of facilities have created these behavioral health teams, where everything kind of funnels through these behavioral health teams, because then you kind of start creating these specialized staff teams, which could actually not only increase the level of expertise and knowledge base, but also could be a great conduit to the outside facility and outside providers who may be participating in the care or, when it comes to behavioral health. The other is PAR teams, patient at risk meetings that a lot of nursing homes have. That is, clearly when we have an area of priority that we want to really be able to monitor if we're doing a good job, then that is where we will take our, discussion and, because we are meeting on weekly basis and talking about, are we providing the care that this particular patient deserves, who may be having opioid use disorder. So those are some of the ways that we can actually really start to focus on, creating teams who effectively care for patients with opioid use disorders.
Great tips. Now, Bert, one of the things that Dr. Gar mentioned as far as something that's really important to provide is training. You do a lot of that in your role that you have currently with the Center of Excellence. So, Bert, and thank you earlier for sharing your personal story about your own perceptions and how you were able to grow through that and learn different ways to kind of fight that stigma that even you had about some folks as well. That are dealing with substance use disorder. So, Bert, from your perspective, specifically as a trainer, what are some of the perceptions that you're currently seeing? If it's something that actually you used to see yourself or you used to face yourself, what are some of the perceptions you're currently seeing? And what are some very specific tips, especially because you provide training in this area, that you could provide to facilities on how to grow through that and get past that?
When you talk about substance use, there is just this overhanging cloud. It's stigma. It's an attitude of judgment. It's an attitude of, just really that casting judgment, characterizing a person by their illness. What the way that impacts the care setting is, if you don't have a supportive care setting, if you feel judged, it affects your identity, it affects your self-image. So when you're considering stigma, one approach that you can take is using person-centered language. Person-centered language is about respecting a person's dignity, their unique qualities, their strengths, their individualism. So to erase stigma and to take on person-centered language, I can give some examples. So when you're talking substance use, when you're talking drug screens, when you're talking groups, you hear words like addict or user or junkie. But when you're using person-centered language, you can reset the setting. So instead of using addict, you could use a person with a substance use disorder. Coming into the care setting, we had people that came to units for substance use care like a number of times. Sometimes in that care setting, it's supposed to be a care setting, but you would hear things like, oh, here comes a frequent flyer, meaning a person that came for care over and over and over again. So instead of using frequent flyer, you could say that this person is still actively seeking substances. When you talk about older adults, just to make it, to drive the point home, you have older adults they utilize wheelchairs. So instead of saying a person is wheelchair bound or they're crippled, you can say he or she uses a wheelchair. Just to recap, I really think what you put out there, the type of support you provide, really affect the results that you get. And that begins with the staff. It begins with the infrastructure of the nursing facility. How much emphasis do you put on training? How much emphasis do you put on when you recognize that you're doing something not so well? How do you address it? How do you change the behaviors and the attitudes of your staff?
That's so important. So definitely recognizing that there's a problem, recognizing there's a challenge there, and then wanting to make a difference and to change, and being open to changing that terminology that's being used, changing that dialogue that's being used is really important. Because if you change your mindset, then you ultimately are changing your actions behind that as well. So that's awesome. Well, we hope that you've enjoyed this episode of Making Healthcare Better podcast. I'd like to thank Dr. Gar and thank Bert for joining me today and providing that insight. And just remember that you can always go to the Center of Excellence website at nursinghomebehavioralhealth.org to find information about trainings, some that Wilbert actually hosts, to be able to get some insight on things that you can do to help make your facility better as well. So we thank you for joining us and have a great day.